For years, Uganda has made a significant progress in the fight against HIV and tuberculosis, but health authorities and implementing partners say persistent new infections, missed clinic appointments, and clients lost to follow-ups continue to threaten gains made in epidemic control.
About 185 clients in Kampala are living with HIV and are currently on treatment. That's a very huge burden. So this is basically for the whole city. And to mention is that we have a prevalence of about 5.6 from what we have, the data that we have 2025. And for KCCA has 6 directly supervised facilities, and these are at sites.
Kampala's HIV/TB stakeholders are being brought together to review the city's performance and agree on practical interventions. The objective is to move away from isolated interventions and create a coordinated regional response.
Uganda's Commission is saying this is the time for us to have all our aid service organizations get accredited. Because through accreditation, we are going to be able to coordinate. We shall be knowing that organization so-and-so is providing such and such services and such specific area. Because when we do the accreditation, that online system, it specifies where, what is being done.
The stakeholders were expected to examine the key HIV and TB indicators against national and global targets, identify poorly performing areas, and share interventions that are delivering results, with main focus on integration of HIV and TB services.
In Kampala alone, we receive over 200 new infections in Kampala. And that's quite big. We have already over 180,000 people on medicine. Over 200 every week, that's high. Therefore, I want to request people to make sure that they do all it takes to reduce HIV/AIDS, which is one of the biggest challenges that we have.
Programs like PrEP, which we heard about, EMTCT, are preventing new infections in both adults and children across Kampala. And all of this is very encouraging news, and we shall be proud of that, of those accomplishments.
Beyond clinical care, stakeholders say that the response must address the social and structural factors that contribute to people dropping out of care.
We're looking at what could be the city's current priority. In this, our recommendation would be to maintain the treatment outcomes we have already realized as partners, while we're closing the points where clients are still being lost.
For Kampala, stakeholders now want this collaboration to translate into stronger prevention, early diagnosis, uninterrupted treatment, and better viral suppression. The ultimate goal is not only to increase the number of people accessing services, but to ensure that those already in care remain on treatment and achieve the best possible health outcomes. Zahara Abigaba, Rogers Komagon for UBC News.